Hi, Caitlin. Hi, Alex. It's a complete honor to be interviewing you today and getting a chance to know the work and impact of Miricyl over the lives of people. You, uh, who are going through some tough times as far as their mental health is concerned. So, to understand and delve deep into what Miricyl does and how it has affected people, we will be going through certain set of questions that we pre-shared with you to uh, to make sure that we can incorporate as much content as possible in this limited amount of time. So I'll be starting with the first question, which is what is mental health and what is Miricyl doing to help people suffering from mental health problems?
This is me. Quite scary. I've never been interviewed with a recording before. It's kind of different to a conference call. So I guess people say that everyone has mental health. You know, sometimes people are happy, sometimes people are sad, and then for some people, it goes outside of what you might think would be a normal range, and so they become sad, and then they become depressed, and they stay that way rather than for a few minutes or a few hours or for a few days, but for some weeks or for some months. And I guess that's just looking at like depression, but there are other kind of long-term illnesses like autism or schizophrenia that all kind of create changes in people's mental health. So yeah, we're doing what we can, particularly to help young people. They say that 75% of all mental illnesses start before the age of 18, and so like we felt as a charity, if we were going to help people, the earlier we started, the better, because some habits might become ingrained by the time you're 25 or 35 or 45. And also these young people, they have their whole lives to lead. So, we want to try and make it as good as possible from the age of 14, 15 or 16.
And then I was going to say, so what we're doing in terms of trying to help people is we're trying to help people find help, access help, and then to stay well. So taking them through the whole process of their journey with mental health, and so making sure that young people really are able to transform their lives for the better.
That's great. And when you say that you help people find help, how do they find you to begin with? Like, is there somebody in between, or you directly reach out to people? Like Alex mentioned that it can start as early as 18 years. So do you go to schools or colleges, or do you have social media pages? So where do you see people approaching you?
It was actually just before the pandemic started. We started building digital tools to help young people affected by their mental illness. So we ran a lot of focus groups with young people and their parents and doctors and social workers as well. And the thing that they thought was most important to them was like a signposting tool that could direct people to the right services for them in terms of like what online support we could provide. So we created a website. We went across all the charities that we could find listed in the UK that provided support for mental health. So that's like mental health charities like Anxiety UK or No Panic or OCD Action, that are illness specific, but also there are charities that deal with debt, housing and relationships, which are all issues that occur more frequently when you have a mental illness. So we listed all these on a website we created, and you can search the website by picking an issue or a condition that's affecting you, whether that's anxiety or eating disorders or unemployment, and then the results that it returns, and we list all the charities that would help someone with that particular condition or issue, and you can click a button and you can make a phone call to that charity. If you click a button, you can send them an email. And if those charities had directories of local support groups that they list, then we've got a button on our website and we take you straight through to their directory. So we did what people told us they wanted us to do. So that's what we built first, and then Caitlin came on board and kind of pushed that out to other charities and through social media. So I don't know if Caitlin, if you want to talk a bit about that.
Yeah, sure. So, well, firstly, taking a step back, I reached out to a lot of charities and universities within the UK, primarily up in Scotland and then some in England as well. just trying to reach out, trying to spread the word, just trying to tell people we have this signposting tool and that we would like them to list us on their websites if they would like to. And we ended up being listed on, I think it was about 4 or 5 different charities, as well as a couple of universities within the UK. And then, going on to the social media. So we've got a range of social medias that try and reach out to all the different types of audiences. So we've got TikTok, which obviously is kind of TikTok and Instagram. A lot of younger people tend to revolve around. And then we've got things like Twitter, Facebook, which are obviously the older captive audiences. So trying to just reach out to everyone that we can, trying to make sure that we've got all the audiences that we can and everyone that, is affected by mental health that we can reach out to.
So we also, Google provides like an AdWords grant to non-profits. So for any non-profit, they'll give you $10,000 a month of AdWords that promote your charity using certain search words to the top of the list. So we use that quite actively. And we've been working with JP Morgan, and they've been helping us develop kind of the next stage of our website and app. And we just had a call this morning with Caitlin, kind of discussing how we would go out into schools and to local doctors, and youth clubs, to kind of promote the kind of service more locally, and just see how that works as a on-the-ground way to promote what we're doing. And then we'll continue using the social media like outreach to other charities to spread our kind of service about nationally.
So I believe the thing about putting yourself out there so that people know about you also can vary from the age group of the people who are suffering. So be it if we want to target the younger audience, we obviously have TikTok, Instagram, and if it's the middle-aged people, we have Facebook and Twitter. And when it comes to people who are a little older, so you have these Google searches, the websites, and obviously the institutes around them. That's a nice way of making sure that every person from every age group is addressed. So this tells me that mental health is something that's not bound to a specific age group or to specific people from a specific place, or to the type of life they're living, or which bracket of the community they belong to. Are they poor, they're rich, the middle class, upper middle class? So it's very widespread. So I'd like to know, how does prioritizing mental health improve the overall quality of our community? Like we've seen, it's not limited to one group.
I was just going to say, I think it's like a feedback loop. When one person starts to get help, starts to feel better, then the next person that is affected within their close network, they'll start to feel better, and it's a chain reaction. Once one person starts getting help, they can help other people get help, and it will circle back. And so once you start like helping a certain group of people, it can spread outwards from there. So I think it's obviously mental health is such an important thing. So once you start helping other people, they will be more inclined to help other people, and then the whole community will benefit as a result.
Yeah, and there are actually, there are groups that are more affected than others. So women, are more affected than men, particularly with like anxiety or depression. And whilst, addiction and some psychotic illnesses might be slightly more, but not that much more skewed to men. There's definitely more women affected than men. If you're poorer, you're twice as likely to be affected as the richest 20% of the population. The poorest 40% of the UK are twice as likely to be affected as the richest 20%. And young LGBTQ plus people can be as much as 3 times more affected than the average person, which probably means that 20% of the people in the UK with mental illness may be in the LGBTQ plus group. So there are definitely there are some more high-risk groups. And the UK government's kind of recognised that women aged 16 to 24 is one of the high-risk groups, and then kind of slightly middle-aged women, kind of in their 40s, is the second high-risk group.
tips and how do people deal with their mental health situation when they are actually not able to come out, because it's not always easy, as you guys know best, it's not always easy to come out and discuss these things about people. So tips for those people. And the second is, there's a myth that if you are suffering from mental health, you will have to go seek psychologist help, which can get expensive sometimes. So is it a myth, or this is actually true?
I guess we're kind of lucky in the UK. We've got the National Health Service, the abbreviation is the NHS, and that is kind of universal healthcare for everyone. So you don't have to pay for any form of healthcare in the UK. It's just we pay our taxes. That's some of the way it gets spent. I mean, some of the waiting lists can be quite long. You know, you might be waiting, a young person might be waiting 4 or 5 months or maybe a year to be seen by a specialist service. I know that's a little bit crazy. Amrisha was looking surprised. I found a young person who was put on a 5-year waiting list to find out whether they had ADHD or not, which is just so, yeah, so our NHS, like, it's good when you get there, but it's not always there for you. I mean, I think if you are affected by mental illness, you should go out and get whatever help you can find as soon as you can, because the sooner you deal with it, the better. It's difficult for me to like understand what that might be like if you're in a country where you do have to pay for it, because that kind of puts an extra barrier. Although in the UK, you know, if you're ill and you see the doctor and there's nothing they can do, then in the UK you'd be faced with having to pay for a counsellor yourself, which would maybe cost like £50 or $70 an hour, and that's enough money for most people in the UK to look at it and go, well, that's quite a lot of money, maybe I should, maybe I shouldn't. And like, I've been in that situation myself, and I've looked at it and I'm like, yeah, that's a lot of money. But I still think, you know, like there's a saying, it's like, it says health before wealth. So I think if you're affected by mental illness, I would say, you know, go and fight or pay for whatever help might be available to you, and at least, you know, try it and give it a chance. And if you try it and it doesn't work for you, then, you know, try the next thing. But like, I would certainly recommend getting medical support as soon as possible. In the UK, you know, it should be fine. You go to your GP. No one needs to know that you've got mental illness. Quite often people have anxiety about going to see their doctor and, you know, what they should or they shouldn't say to them. But yeah, I would say it's hard when you're ill, you know, because your brain's doing, that's why you're ill, isn't it? Your brain's doing funny things to your mind. And, you know, like, is it me? Is this how I feel? Do other people feel like this? But I would always recommend going out and looking for help. And then I think the other way to look at it is, you know, most people have been to school. So, you know, you've got your favourite teacher at school, you've got the worst teacher at school, you've got people who are okay. You know, that's the way you've got to look at any healthcare professional you're going to encounter, whether it's a doctor, a psychologist, or a psychiatrist. You know, just because they've got letters after their name doesn't mean to say you're going to get on with them. So yeah, so if you meet someone and they're not for you, well, not every teacher at your school is for you either. So go to the next one, because the relationship you have with that person can be at least as important as the treatment they're giving you. But yeah, I would always say, where possible, reach out for some kind of help.
And I was going to say, so to answer your other part, what are your tips? I'd say really it can be something as small as just starting the conversation. Obviously, I'd say it can be as small as sometimes and oftentimes for someone that's suffering with a mental health problem, that can be quite a scary thing. But even if it's just something as simple as finding someone you trust, you care, you can just start the conversation, just broach the topic and just say, I might not be okay, sort of thing. It doesn't need to be a huge deal. It doesn't need to be something that is a massive thing. It can just be as simple as that, and then it can often snowball from there in a good way, and you can go get help. They can help you. You can figure out a plan of action. You can figure out next steps, all of that sorts of stuff. So that would be my tip in terms of how to start getting help.
So I guess over here 2 steps are involved. First of all, finding the right person, and second is just saying that, you know, I don't feel good, and the rest will be taken care of. That's a nice tip, I guess. So what are the few things you wish people knew more about mental health?
I think just that everyone has their own mental health. Everyone has things that they might not necessarily suffer with a mental health problem, but everyone has sort of situations or trigger words that will affect their mental health, and whether that be in a good way or a negative way. Everyone has their own mental health, and I think you have to just remember to be kind and patient with everyone. Everyone has their own things that they are dealing with that we're mostly not aware of. So I think you've got to just be very careful of that, but just remember that take care of not just everyone else, but also with yourself.
Yeah, I think I find it very hard to kind of, because it's, you know, it's not visible. It's quite hard for people who haven't been affected by mental illness to kind of know what it might be like for someone who does. Even like if they're trying hard to understand, it's still hard for them to get it. So I don't know. Yeah, if I had a magic wand, it would be to help. Like, I don't want to have other people affected by mental illness, but like make it easier for them to go, oh right, okay, that's what it is. I mean, yeah. So everyone kind of, you know, knows what addiction is. And I'm like, okay, yeah. And then I kind of live with this guy. I mean, you know, he would just get a bottle of wine and he'd just finish it. And then he might be looking for another one. And then he'd be going like, Alex, is that your wine? And I'm like, yeah, well. And it would just disappear. And he just could not stop. Just could not stop. And he functioned and it was fine. And like, if I have a drink, you know, I might buy a 4-pack of beer, I have a couple, I have no interest in drinking more than that. A bottle of wine, a couple of glasses, no interest in drinking more than that. He could not stop. And he had to finish whatever he was drinking, and then he'd be on for the next thing. And it wasn't until I lived with him that I could really see that he just had like no control whatsoever to do it. But that's just the way I learned. But you know, well, you know, I'm kind of old, so it was a while, and then I ended up with this guy, and it was like, wow, you know, that is what addiction is. You just can't stop. It's not like, oh, well, let's have another drink. It's like, and then I'm not particularly affected by anxiety as a sort of particular condition. And I meet these people who are anxious, like, can you explain that to me again? You know, and I kind of, I mean, I've been affected by depression and psychosis, and like when I'm quite unwell, I have like kind of a mixture of feelings, if you like. But yeah, it's really hard to say. Someone says to you, I'm depressed, and they've never been depressed in their life, and they go like, well, you know, what is that? Are you just having a bad day? You know, like, so yeah, it's maybe that's just some people are more empathetic than me. It's hard to like, what would I want other people to know about mental health? You know, I'd want them to know like autism. I don't really know what is, you know, what's it like for them. So yeah, maybe, so yeah, help people understand what other people are going through without needing to go through it themselves.
But yeah, I think it's just a case of being patient with everyone. Everyone has their own way of dealing with things, and we don't necessarily have to understand, but as long as we can be patient with them and we can be empathetic towards that and how they might be feeling, then that's at least good enough for a start.
Yeah.
Absolutely correct. Even I feel that people who have not faced such an issue will never understand what it's actually like, and the least we can do is, even if you do not understand, just have like you said, Katie, just have patience and little humanity. I'll say. So I had a time when I was myself suffering through depression, and until before that, I thought that it's something people really make stories around, and it does not really exist in real life. But then only when I went through that, I realized that no, that's not the case, and it can have various forms as well. So it's not very easy to diagnose. This is what I felt. And this reminds me of a meme, actually a reel that I saw, where somebody says that the person that I'm facing, I'm going through depression, and the other person is like, oh, why are you facing depression? Life is so beautiful. Go out, enjoy, talk to people, socialize, it'll be okay. And then the third person comes in and says that it's just like saying, oh, why do you have asthma? There's so much air.
Yeah.
Yeah.
Totally. Yeah, I've got a broken leg. Well, why don't you go do a run? Yeah.
So this I feel whoever says that depression or mental health illness or anxiety, they do not exist, I would show them the street. Like, look, this is the definition of it. So now that we are talking about how people can perceive something like this in various ways, what do you think some of the greatest myths are there around depression and anxiety and all the types of mental health illnesses?
Where to begin? There's so many myths about mental health.
Go on, go for it.
I don't know where to begin. I think I think that there's one that I particularly dislike is that, oh, I'm not bad enough. It's, oh, I don't have enough of an issue to go and get help. And it's like, no, if you're feeling a certain way and you're having those thoughts, if you're asking yourself, oh, it's not bad enough, it probably is. And it's that stigma still. I think that still we're a lot better than we were, and there's a lot more open conversations surrounding mental health. But I think it's the fact that people still think they have to get to a certain level before they're ill enough to go and get help. And that's a pretty dangerous myth that I think still kind of exists, especially, and I hate to say it, but in terms of gender, men are still more or less likely to go and get help because they think they're not bad enough. And I think we still need to open up that conversation and tell particularly males that they can go and get help, and that it's okay to, and that no one is stigmatizing them because of that. That's one that I feel quite strongly about. But that's one of the myths that I particularly...
What sort of myths were you thinking about, Miricyl?
Myths that I feel is it does not exist. You have to it's an escape that you're plotting just to get away from the actual duties that you have. It can be like that, and this is something that I heard, that you need to socialize more, and extroverts cannot have such issues. This is something. So if somebody is introvert, means so you have issues. That means if you cannot talk to people, but then that's not the case. It's just that's a personality type. So it does not have anything to do with the level of socializing you do. And like Alex, you mentioned that it's not something that stays for very long. I've known people who have suffered with it for quite some time, as long as 10 years, 11 years. But then if you get help, early on, it will stop bothering you.
I was doing like group therapy with a psychologist. We were talking about getting out of bed in the morning, or not getting out of bed in the morning, and like whether, like, am I ill or am I not ill or whatever.
Exactly.
He said, well, there's kind of a difference between I can't get out of bed and I won't get out of bed. And like, I won't get out of bed, you've made a choice. I can't get out of bed, which is what you feel if you get depressed, it's not a choice. You just physically or mentally, you just want to curl up under the duvet, hide under the pillow. You haven't got a choice when you get out of bed or not.
I feel there's another symptom where you do not feel like eating, or even the daily chores that you do becomes a big task. And like you mentioned, Caitlin, there's no we do not have a way to quantify it. Like, only after certain time we'll go and seek help, but then where is that certain time? after 7 days, after 1 month, or after you can really not get out of bed. So because the wound is up here, I feel until unless it's in your body, you can physically see it, you can actually say that okay, it's getting bad, or like or it's getting better, or I should go see a doctor, or I should take medication, or I should stop medication. But then when it's inside and you can't see, it's really difficult to tell. So educating people is the only thing that can help. That's what I feel. And now that we were talking about myths, so do you feel that this myths, how better has it gotten? Because even now I hear people saying myths despite of so much campaigns and so much awareness. But then, so was it even worse? Like, 10 years ago, or maybe 15 years ago?
I mean, I think that because there's more campaigns about it, there's more social awareness, it's definitely a lot better. I mean, even when I was in school, like, 8 years ago, there was still, there still wasn't as much of a conversation about it as there is now. And I'm very grateful for the way it's gone, but I wish there could have been more when we were growing up. But it's definitely gotten a lot better, but we've still got a long way to go, because as I said, there's still that stigma that surrounds especially young men, or men in general, getting help for their mental health. That is still, I think there's some statistic, you probably know it, Alex, that it's the leading cause of suicide is the leading cause of death in men between a certain bracket of ages. And I think that's such a horrible statistic that still exists, and that's been a statistic that I've been aware of for a good number of years, and it's still not changed. So I definitely think we're going a lot more in the trajectory in the way that we'd like to, but there's still a long way to go, for sure.
So the statistics are that it is getting slightly worse, but the academics, when they look at the statistics, are like, well, maybe that's because people are reporting it more, because it's become more popular, although they were using proper clinical questionnaires to do the survey. So I think I'm right in saying that self-harm in young women has gone up from something like 1 in 10 to 1 in 4. I might be not quite right on that, in the last 20 years. And then they say, well, that's maybe self-reporting. And the NHS did a survey last summer, I was just writing about it yesterday, and probable mental illness in 6 to 16-year-olds had increased 50% since 2017. It's in 5 years. And then there's another stat that anxiety and depression's increased by 50% since the birth of Facebook. So, I mean, they talk about, I'm not in a school, I'm not age 17, so I don't know who's talking about depression and who's saying, oh, you're not really depressed. But statistically, it's got worse, so you'd expect people to be talking about it more. Caleb, what do you think? Do you think there are young people talking about it?
I definitely think more people are open to having the conversation, at least, because if you were to ask, I think even just the generation above myself, if you were to talk about mental health, there's still a certain stigma that persists. There's still people that will kind of shy away from the topic. Whereas if I was to bring it up to a group of my friends or peers my sort of age, they would be a lot more open and willing to have that conversation. But I think also, so with your statistics just then, I think we mustn't forget that we've had the pandemic, and that has affected everyone's mental health, whether that was in a positive or more likely in a negative way. So self-harm or suicide statistics, they probably will have gone up, unfortunately. But then we've had an unprecedented pandemic. We haven't had that to deal with before. So potentially that's not helping the statistics, and it makes it seem like we're not going in the way we would hope. But I do think more people are open to having the conversation now, which is an important step.
I think digital's maybe just accelerated or magnified.
Yeah, I'll agree with that. Mental health. Yeah.
I mean, when I was being brought up, like, so, you know, I was a teenager in the 80s, and smoking, it was like, well, smoking causes cancer, but you would still get the occasional report, probably from a cigarette manufacturer, saying, well, you know, it's not that bad. And we could still buy packets of cigarettes with Marlboro. There'd still be adverts on the side of the road saying, Marlboro Man. Oh, that's cool. I'll sweat them. And then, you know, over the following, and then within about 15 years, you know, we banned smoking in all public places. And it was very definitely smoking kills, and we're changing the packaging, and we're showing the inside of people's lungs, we're not showing the packaging. So, you know, social media's definitely got a good side. You know, it helps people stay connected. I mean, like last week, I got in touch with someone I haven't seen for 15 years, but I worked with him, and he's on my LinkedIn contacts, and I could just find him straight away. And he said, oh yeah, I can help you, let's have a chat. So it's like, you know, it's super positive in some ways. And it doesn't, I was also talking to some young people about it, and there was this lady, and I said, so how many messages do you get a day? She said, well, I'm on a Facebook Messenger group with about 50 people who just created for an event. And she was getting hundreds of messages on Snapchat, WhatsApp. I said, do you ever turn it off? She said, no, it's fine. Right, and then I spoke to someone else who was probably getting half the number of messages, and she just turned it off because she just couldn't cope with it. So, but I suppose, you know, no one's really come to a conclusion, but I think there are, you know, you can be online bullied in a way that you couldn't be bullied 10 years ago. Right? And it's everywhere, and everybody knows you've just been kicked out of whatever group. And then you've got all these people, you know, putting on fake tan. Like, they had a six-pack anyway, now they've definitely got a six-pack, or the girls have done whatever they're doing. And people are looking at this going, my God, why can't you do like that? It's just, it's not even real, you know? I met a photographer travelling, and he had this picture of a paddy field, and I was in Vietnam. It was like bright green. I said, they're not that bright green, you know, because they're pretty dry in places. It's not really that attractive. He said, yeah, no, I touched it up. I said, show me another photo. So it was like this Vietnamese person in the field. And he said, yeah, there was some rubbish there, but I cleared it up, so the photo looks better. And then we got to, I said, is there any photo? He's a professional photographer, so he posts to Getty Images and he gets paid. I said, is there any picture you haven't touched up? He went, no, I touched them all up. Every single one. Right, so if you look on Getty Images, none of it's real, probably. I don't want to slant the Getty Images, but every single one. So, like, you know, we're looking at these images of, like, you know, it's having,
Yeah.
they're definitely positive. I don't want to be out there saying, you know, but it's like, I don't know, Kate,
That-
more
I was going to say,
if someone turns off their social media because they're unwell, I mean, what does that tell you? Like, what do they think? They think this is a major impact on their lives, so they just hit the turn off button.
yeah, it's social media and images. I think there's such a toxic culture surrounding imagery and how we present ourselves online, because yeah, how many of us have gone to put an image up and then gone, oh, there's this part about myself I don't like, or I don't quite like this, oh, I won't put it up because I won't get as many likes as I would want, and things like that. And I saw a scary video the other day of someone explaining how you can actually, because obviously we've always known, or we've known for a very long time now, that you can Photoshop images, so photos that are obviously still not moving. We can now Photoshop videos, and we can change how a person looks. So someone could be moving about in an environment, and usually we use that to try and say, oh, well, that's bent out, they've obviously edited that. But now we can't do that because they're editing videos of how they look, and it's making the background look normal. And it's simple things like that. Like, you know them logistically. When you're viewing something, you can say, that's not real. But then when you then try and translate that back to yourself, and when you view yourself in a mirror, or your own photos and the ones that aren't edited, you can't compute the two together, and it makes you feel terrible about yourself because you're constantly being bombarded with these images of people that look perfect. So it's hard to have a good image of yourself and therefore your own mental health, because you're constantly being shown that the way you look or what you're doing isn't enough. And I think that's such a toxic culture that I dislike the fact that it's being perpetuated by everyone. Everyone's doing it, and we're all guilty of it. I can't say that I'm not even. I've not touched photos up, but I won't post ones that I don't like. And I think we're all trying to give everyone that sort of perfect filter of our lives, and I think it's just so toxic for mental health. It really is.
And if you see something on YouTube and TikTok, it's because it's like good or successful in some way. The person doesn't have to be good looking. It might be a very funny joke, or they're just good at selling a particular product, but you're still only seeing the best of.
So it doesn't even have to be, like you're saying, it doesn't have to be the prettiest person, but if they've got the best clothing, or vice versa, and you can only ever see the best of what society has to offer. You never see kind of the average or the mediocre or lower than that.
This photographer I was talking about, he was a professional photographer, then he gave up right now when travelling. I said, so what's the best thing you photoshopped? He said, well, I had a red-headed model with freckles, and the client said, we want a Latina woman. So he turned it from redhead to dark, and he took out all the freckles, slightly darker than skin. And everyone thinks it's some Latin model. He's like,
No, that's scary. Like, he is completely transforming the picture to something that it was not at all originally. So this is completely correct. Where so I believe the different age groups suffer because of different reasons, and one of the major reasons that covers up people throughout, like it has no barriers, is the social media, where only the perfect things are there online. And even I believe everyone, nobody wants to show their struggles or the negative side of their life out there. It's always perfect, it's always made up, it's always success, it's always beautiful, it's always the best. And that is something that becomes very hard on other people who are dealing with issues, and they really don't know where to go to. And sometimes these things are the reasons they are dealing with issues. So I remember a picture that I saw very recently. So there's a half-eaten apple, and then there's a mirror in front. So from the back side, the apple is eaten, and then in the mirror, it looks perfect. So yeah, that is something that sums up how the social media is affecting us and the society in general. So we all know what the issue is. We all know what the problem is. We are talking about it. That's absolutely correct. But how much is it getting acknowledged? So I feel the implementation part is something where we are lacking now, because when we were discussing about the range part, like what is the improvement, and when Alex said that it's actually getting worse. So yes, I completely agree to it, that it's actually getting worse, especially considering the fact that we had the pandemic for almost 2 years now, and now we have the social media and the perfect lives that are getting flashed on our screens. So the stats are bad, but then at least people are coming out and speaking. Maybe that's why the stats are bad. But then the main problem is not getting solved. That's the main thing. And I believe until unless it is acknowledged, nothing can really do to improve the situation. Because I remember a friend, and he told me about his university, where if you go to the authorities or to the teachers and say that, hey, we have an exam, but I won't be able to give the exam because I'm not feeling mentally correct or mentally sound to sit for the exam, and they actually exempt you, or they give other dates. So this was something that was very shocking to me. So I really hope things like this really happen. So jumping on to another question, I really want to know how the volunteers can help in this cause. The people who want.
Sorry?
So the volunteers that we'll be having.
Okay.
Yeah. So what can they do to help this cause?
We, like, as a charity, we've decided to develop a digital solution. There are other people who are going around schools and universities, giving classes or working for youth groups, and just as an organisation, we've decided to develop a digital product. So we developed our kind of signposting tool with a group of volunteers in Scotland. It was like organised. There were up to 1,000 volunteers as part of this organisation. It's called the Scottish Tech Army, and they helped us create our like signposting tool. And then with that, we got the opportunity to work with JP Morgan, who do some more kind of organised volunteering, and they're going to deliver like our next minimum viable product in the middle of June. And I guess we welcome any like developers in WordPress or React who like would be interested in taking forward the work from there. I've got some like a couple of people who are more like going to provide guidance, but won't actually be doing so much of the coding. But yeah, if there were some volunteers who wanted to do some coding, that'd be amazing.
I think other things is obviously we are a non-profit charity. We do have a GoFundMe account. So even just as simple as like a donation, just so we can continue doing what we're doing. Just something like that would even be helpful.
It's really great. And now with the next question, we'll be moving on to the end of our interview session. So the last question is, what's the one, so that's not really a question. So what's the one message that you would like to give the people who are listening to this interview?
I think I'd just say that I've said it a couple of times, but I want to reinforce it again. It's just start the conversation. Even if you don't have anything particularly right now that is on your mind or that you're suffering with, even just starting the conversation and saying, look, I want to talk about my mental health, I trust you, you're the person that I want to talk about it with, even just checking in on a couple of other people, just saying, look, how are you doing and how's your mental health at the moment? Just starting the conversation so that then if something down the line does happen, then you can bring it up to them and say, look, you know how we had that conversation a couple of weeks ago, okay, I'm having not such a great day, can we talk about what I'm thinking about or dealing with now? Just that would be my kind of takeaway from this. It's just start the conversation.
So yeah, mine's kind of the same, just slightly different direction. So like 1 in 4 people have a mental illness today in the UK. I'm guessing that's not dissimilar in the same in the States. I'm not sure about India. But there are 3 in 4 people who don't. And at least half the people may never like experience symptoms and won't be able to understand what it's like. But what I would say is, if you're concerned about someone else, obviously everyone says, how are you? And everyone replies, I'm okay. And then you move on. And I've heard other people say, well, why don't you say, how are you twice? Which is like, well, that's fine. But like, I mean, I work for a charity, I get a lot of volunteers, and like most of them volunteer mostly because they've been affected by mental illness, and some of the time because their family have, some of the time they just want to volunteer and they think it's a good thing. But I find if you want to get someone to talk about, if you want to get someone to talk about mental illness, talk about yours first. And you say, I've been affected by depression like this, blah, 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 blah. And then the person you're talking to is much more likely to come and start telling you about theirs. And if you haven't been affected by mental illness, well, you could talk about a bad point in your life and you can say, but you know what, I wasn't depressed. And obviously some people are. Or you can talk about a friend and say, I was with my friend last week, they were feeling X, Y, Z. And I think that's like a good way to get a conversation going with your friend or family member who you're worried about.
I feel, Alex, what you're trying to say, I can sum it up in 3 points. Point number 1 is, we always ask people, how are you? Are you okay? And it's very casual. We do not expect a real answer from this. So we can just reiterate the question, be like, are you sure you're okay? Yeah, asking for the second time, how are you? So that's the first part. And the second part is making the environment really comfortable for the other person. First, you can do that by stating your own journey. Like, it's okay if you are not okay to share this, listen here. So this is my story. And the third thing is accepting the fact that I might not understand what you're going through, but I am completely open to whatever you're saying, and I'm all yours, and I'm sitting beside you, listening to you. So just be honest. And so with this discussion, we come to the end of our interview. And thank you so much, Caitlin. Thank you so much, Alex, for joining in and shedding so much light on such a sensitive and an important topic. And I believe, this does its small little part in uh, enlightening people and really pushing them to take something like this seriously and acknowledge it. And yes, so we have a ritual here. By the end of the interview, we do a sign, and the creative team at the back end takes a screenshot. So any sign that really depicts the purpose of Miracle or shows like something like a heart or yes, we won, yes, a hand gesture.